I'm Dr. Anita Sturnham, founder of Nuriss Clinic, and I'm here today with Dr. Natalie Hammer, and we work closely together at our clinic in London. And today we're talking about a really hot topic, which is all about longevity. So longevity, what is it? Longevity is all about promoting your lifespan, prolonging your life, but also about promoting your health span. So increasing the number of years that we live in a healthy way. And there's so many ways of kind of looking at longevity in terms of diet and lifestyle and interventions that you can do. So we thought we'd break down some of the hot topics around longevity and also talk about what we do in our clinic to help promote longevity too. At Nuriss, our focus is very much around skin health, how we can slow skin aging, but we take a holistic approach and look at your systemic health to optimize the longevity of that to improve your skin health. So let's break it down into what your view is on the longevity space and how you talk about it with your patients.
Well, I think longevity is a very exciting topic. It's a new topic. If we were looking at 10, 15 years ago, there wasn't a lot, even in the space of what is offered here at the clinic, that you can do GI mapping, whereas before we were just labeling everything as IBS because we didn't really have a diagnosis for it. So I think the longevity space is very interesting because now we have more tools to help map out longer lifespan, but also we have tools to make you look better, make you feel better. We didn't have those before. We work with the skin day in, day out, but we can do more things than just put fillers and Botox in someone's face. We are now turning a different wave towards regenerative medicine, and that is longevity because people want to do things more long-term than hang on to, okay, I can do my filler, that'll last me a year, but in the long term, I want to age well. I want to look healthy.
We're definitely seeing that trend, aren't we? And so we actually now offer skin longevity consultations at the clinic, which involves a thorough analysis of your systemic health and your skin health. And we use scanning technology with AI technology to accelerate your skin aging all the way up to 80, which shows us where the vulnerabilities are in the skin. And then we can take a preventative approach into slowing that skin aging or promoting its longevity. The other thing we do is skin DNA analysis. So we take people's DNA and we look at their genetic risk factors for skin aging. So we can be really, really precise in where do we need to intervene. And then that's where we are kind of a dream team together really, because then you take over and look after the systemic health as well. Tell me a little bit about how you're focused on hormones and kind of gut health and IV therapy can help with that longevity piece.
For me, I think it's very interesting when patients come in and they're wanting to not only look better, but feel better. And not only can we offer them kind of a basic blood profile, but instead of them just coming in and having an IV of vitamins, we can say specifically, well, you are deficient in this, or actually you're not good at methylating glutathione, or actually you need more glutathione. And we can tailor a treatment plan for them, not only with their IV, but we can also look at other ways to help improve their skin health, whether that be with polynucleotides. Other things that I find that's beneficial for a patient that comes in and wants to improve not only their skin, and that we can do in the clinic, not only focusing on weight loss or IV therapy, is a great test. It's very underrated, is the Dutch test, because the Dutch test helps identify which hormones are lacking. If I take your bloods right now, Anita, this is just a snapshot of what I'm seeing right now with you. If I tell you, with your cycle, maybe it's in balance, maybe it's not, on this day, if you'll give me 4 urine samples, I'll have a full picture of what's happening with your cortisol level, how's your testosterone, and that will help be information that I can propose a better treatment plan for you.
Yeah, I agree. I have to say Dutch testing has changed my whole medical practice, and I introduced it into my clinical protocols about 6 years ago. And one thing I was finding, particularly with hormonal imbalance, I would take my patient's blood and it would be normal. I said, great, everything's fine. But my patients weren't fine. They weren't sleeping, they were losing weight, they were moody, they were anxious, their periods were all over the place. Something wasn't right. And then we started exploring the more functional medicine side of things. And actually, interestingly, Dutch tests combined with stool tests, where we look at how your gut is eliminating your hormone metabolites. And I was finding lists of things that weren't right with normal blood tests, but a list of problems we picked up with the Dutch test. So really being precise and looking at your systemic health pathways is the best way of looking after your longevity. It's been a game changer, I think, in this industry, and it's great to see more and more people are integrating these types of tests into their technology as well, into their treatment protocols. I think one thing that's been massive in the skincare side of the industry is the trend now to look at how we can slow skin aging. Healthy skin needs to have several things. We need skin that has a healthy skin barrier, the top layer of your skin. We need low levels of inflammation. Inflammation ages every organ in the body, including your skin. And we need a good store of collagen. So everything we do at Nuriss focuses on those things. Let's strengthen your top layer, let's boost your collagen, and let's reduce your inflammation. And that's where we combine clinical grade skincare with energy-based devices, with things that we can inject to slow that inflammatory process and boost your collagen. So I think we've got the perfect model for addressing that whole skin longevity piece.
And I think it's so important that we can educate patients. That is the beauty of this.
Yeah, they get the 60-minute consultation where we go through everything with them, and everything is personalised and designed to meet their goals. So Dr. Natalie, one of the trends that we're seeing in clinic is focusing around that preventative approach, that longevity approach to skin health. And now what we're seeing is more and more people are looking at ways to keep their skin looking younger for longer with things that will improve their skin health, like the Profilo and the polynucleotides and the laser. But definitely what we're seeing is there's still a place for the traditional aesthetic treatments like the Botox and the dermal fillers. And I love combining the two. So I'd love to hear your views on how you look at somebody's face and their skin goals and how you advise them on that journey.
I wouldn't want to take fillers out of my toolbox, that's for sure. I think that they do help patients a lot. It's not the main thing I would use, but if somebody comes in for a facial consultation, they have volume loss, they don't want surgery, then we have to look at other alternatives. We have to look at biostimulators like radiase or something more volumizing for them. It's either that or fat transfer, and sometimes that's a bit drastic and the results aren't always promising. And I think filler's a safe bet because they will have a natural result that will be enhancing, and it's something that will last. It's not permanent, but the great thing is it's hyaluronic acid. Our bodies have hyaluronic acid in it. And if there was anything to ever go wrong, it's also safe to use. It's reversible. So I think it's a great example that shouldn't be completely bypassed.
I agree. I mean, I love combining the energy-based devices with dermal filler. I think they can be transformational, and your example of volume loss is a key one. What I'm finding is that I need less dermal filler to get the end result that I'm looking for because I've improved the skin quality of my patients. So it looks much more natural. We're not putting 10 mils of filler into somebody's face. We're using 1 or 2 mils, which is, a syringe, which is very small volume, but it makes a significant impact. So I think it's all about combining what you know that works well together and not looking for just quick fixes, but looking at things that are going to improve the long-term health of your skin.
And I think patients want an overall balance. We've gone away from, the Kim Kardashian look where people are wanting these exaggerated features and people are having their fillers. Yes, they're having them removed. But when things are done well to begin with and they are kept up, it's like you are maintaining a healthy face. And so as you're aging, we started with you doing a bit of volume replacement, but now you're maybe 10 years older. We don't have to top it up too much. We're just keeping you looking your best.
Exactly, I agree.